Hi, I'm Dr. Sheikh and this is Dr. Ortner from the Department of Anesthesiology at Stanford University. Welcome to the SOAP POCUS video series. This is Dee Goodnow, our standardized patient. Today we're going to cover point-of-care gastric ultrasound in the pregnant patient at term. The goal of the ultrasound examination is to rule out if the patient is at risk for pulmonary aspiration.
When performing a gastric ultrasound in pregnant women, there are several points to consider. The first is patient position. While the gastric ultrasound exam is usually performed in the supine and right lateral position in non-pregnant patients, for pregnant patients it is performed in the semi-recumbent position. It is important to note that the right lateral position is often not well tolerated in pregnancy. The second point to consider is that performing gastric ultrasound in pregnant patients can be more challenging than in the non-pregnant patient. The stomach is displaced cephalad by the pregnant uterus, increasing the distance from the skin to the gastric antrum. Furthermore, the size of the gastric antrum increases with pregnancy, so formulas used to calculate gastric volume from cross-sectional area of the antrum are not applicable in the pregnant patient. In addition, epigastric probe placement may be hindered by the steeper angle between the xiphoid process and the abdomen caused by the gravid uterus. In laboring women, studies have described inconclusive results in up to 17% of women compared to less than 5% in non-pregnant patients. Similar to the non-pregnant patient, the upper abdomen is exposed, and using a low-frequency curve probe in abdominal settings, the epigastrum is scanned in a sagittal or parasagittal plane, and the transducer is swept from the left to the right in the subcostal margin to image the gastric antrum. The stomach can be found superficially as a hollow viscus between the left lobe of the liver anteriorly and the pancreas posteriorly. Important regional vascular landmarks are the aorta, the inferior vena cava, and superior mesenteric artery. The transducer is moved gently to identify the antrum at the level of the aorta. Depth, gain, tissue harmonics, and focal zone are adjusted to center the antrum. Color flow can be used to visualize the great vessels. Sometimes obtaining images on pregnant patients is difficult. Asking the patient to take a deep breath in and holding the breath at end expiration can help optimize the image. Slight manual displacement of the gravid uterus can also help with image optimization. We are now visualizing the empty gastric antrum with the patient in the right lateral position. We have just shown the gastric antrum when the patient is NPO. We are now going to demonstrate the antrum after the patient drinks 300 cc's of soda and then a light meal. We are now visualizing the gastric antrum in the supine semi-recumbent position. Fluid appears dark and air bubbles appear white on the image. Measure the cross-sectional area of the gastric antrum between peristaltic contractions. In the right lateral decubitus position, as the fluid shifts with gravity, the cross-sectional area of the antrum is noted to significantly increase. We are now visualizing the antrum shortly after a solid meal. In the early stage, the antrum appears distended with mixed echogenicity described as a frosted glass pattern due to a mix of air and solids. In the later stage, 1 to 2 hours after a solid meal, the antrum contents appear more homogeneous and hyperechoic.
So in summary, gastric ultrasound in pregnant women is performed in a semi-recumbent position. Image acquisition can be challenging, so asking the patient to take a deep breath in can help with acquiring a good image. And also slight manual displacement of the gravid uterus can also help in image optimization. If you see clear liquids or solids in the supine position, the patient is at risk for aspiration. If you find an empty antrum, ask the patient to lie in the right lateral decubitus position and make sure the cross-sectional surface area is less than 5 centimeters squared. Otherwise, you can consider the stomach to be full. Thank you for watching.